What if the technique you've used for 40 years is now silently working against your health? Most older men are never taught how to adapt to their body's natural changes. I'm Dr. Sarah, a health educator with over 20 years of experience helping men navigate their wellness journey after 60. The truth is, if you don't change your methods, what once felt good can now lead to discomfort, frustration, and even long-term harm. The wrong technique can quietly damage circulation and reduce nerve sensitivity more than you realize, impacting your confidence. Subscribe now, because this information comes from both cutting-edge science and real-world success I've witnessed in my practice. Today, I'm going to walk you through how to adapt your self-touch routine in a way that protects your body, respects its changes, and supports your pleasure and health for years to come. We will cover the 5 silent mistakes most men make and provide a step-by-step guide for a healthier, more satisfying approach. It's time to update your technique based on what your body needs today. You've just heard me mention the 5 silent mistakes most men make, and I want you to understand something important before we dive deeper. In my 22 years of working with men navigating these changes, I've learned that knowledge truly is power, especially when it comes to adapting to your body's natural evolution. Let me start by sharing Robert's story. Robert is 68, a retired mechanic from Ohio who's been married to his wife Helen for 42 years. He came to me already working closely with his primary care doctor for routine health management. What Robert wanted was to understand why the approach he'd used successfully for decades suddenly felt uncomfortable, sometimes even painful. I coordinated with Robert's medical team, and together we explored how his body's needs had changed. Within 6 weeks of implementing the adapted techniques I'm about to share with you, Robert noticed significantly improved comfort and renewed confidence. His doctor was pleased with his proactive approach to healthy aging. Today, Robert continues both his regular medical care and these natural adaptations, feeling more connected to his body than he has in years. Robert's experience illustrates something I see consistently in my practice. Your body at 68 isn't broken compared to your body at 28. It's simply operating with different needs, different sensitivities, and different rhythms. Understanding these changes is the first step toward working with your body rather than against it. Here's what happens in your body after 60 that directly affects this intimate aspect of your health. Think of your circulatory system like a well-maintained plumbing network. For decades, your blood vessels have been flexible pipes, expanding and contracting easily to deliver blood exactly where it's needed. As we age, these vessels naturally become less elastic, which is completely normal biology. This means blood flow requires more gentle encouragement and more time to respond. Research from respected medical institutions supports approaches that can help with this natural process. A clinical trial registered on clinicaltrials.gov in 2022 showed that daily pomegranate extract use for 8 weeks helped significantly improve blood vessel function and support stable blood pressure in older adults. This suggests real potential for supporting vascular health naturally. Your nervous system also evolves. The nerve pathways that carry sensation work like a sophisticated communication network. Over time, these pathways need clearer, more deliberate signals to transmit the same messages. This isn't nerve damage, it's simply your nervous system requiring more focused attention and gentler stimulation to function optimally. Now, let's address those 5 silent mistakes I mentioned, because understanding these can transform your experience immediately. Silent mistake number 1. Using too firm a grip. Many men unconsciously increase pressure over the years, thinking harder stimulation will compensate for decreased sensitivity. But this actually works against your body's new needs. The solution is counterintuitive. Lighten your touch significantly. Your goal is to create sensation, not force it. Think massage, not mechanical action. Silent mistake number 2. Rushing the process. Your body's response time has naturally slowed, but this isn't a limitation, it's an invitation to deeper connection. Research shows that slow, mindful breathing techniques help activate your parasympathetic nervous system, your body's rest and restore system. This nervous system state is essential for the relaxation your body needs for this experience. The solution here is to deliberately slow down. Give yourself permission to take twice as long as you used to. This allows your brain and body to process sensations more fully and respond more completely. Silent mistake number 3. Neglecting proper lubrication. As testosterone levels naturally decline with age, your body produces less natural lubrication. Many men skip this step, thinking it's unnecessary, but this creates friction that can damage sensitive tissue over time. Use a high-quality, water-based lubricant from the very beginning, not as a rescue measure. Think of it as essential preparation, like stretching before exercise. Silent mistake number 4. Forcing completion. This might be the most important point I'll make today. Your relationship with climax needs to evolve as your body does. Pressuring yourself to reach orgasm every time creates stress that actually inhibits the very relaxation your nervous system requires. Instead, focus on the entire experience rather than the endpoint. Many of my patients discover that when they release performance pressure, their bodies respond more naturally and satisfaction actually increases. Silent mistake number 5. Ignoring your body's signals. Your body is constantly communicating what it needs, but many men have learned to override these signals. Pain, discomfort, or numbness are not obstacles to push through their valuable information. Let me walk you through what an adapted, healthy approach looks like step by step. First, set aside 20 to 30 minutes of uninterrupted time. This isn't rushed self-care, it's intentional body connection. Create a comfortable environment with soft lighting and privacy. Your nervous system responds positively to these calm conditions. Begin with 5 deep breaths. This simple practice signals safety to your autonomic nervous system and helps shift you from daily stress into receptive relaxation. Studies with people over 60 show that controlled breathing can help improve the rest-and-digest response your body needs for intimate experiences. Apply water-based lubricant generously from the start. Don't wait until you feel you need it. This protects sensitive skin and allows for the gentle touch your body now requires. Start with extremely light touch, lighter than you think necessary. Explore slowly, paying attention to what creates pleasant sensation rather than what you remember working before. Your body's map of sensitivity has likely changed, and rediscovering it can be surprisingly enjoyable. Focus on breathing throughout. Many men hold their breath unconsciously, but steady breathing supports blood flow and nervous system relaxation. Use supportive positioning, lying on your side with a pillow between your knees, or reclining with your knees slightly elevated, reduces strain and improves circulation. Comfort directly affects your body's ability to respond. Take breaks when you want them. This isn't a race or performance. Sometimes pausing and resuming actually enhances the experience because it allows blood flow and nervous system arousal to rebuild naturally. Most importantly, release any timeline expectations. Some experiences will lead to climax, others to simple pleasure and relaxation. Both outcomes support your health and well-being. I'd love to hear about your experience with updating your self-care routine. Have you found approaches that work well alongside your medical care? Share your thoughts in the comments. Your insights. Help other men navigate these changes with confidence. Now, let me address when it's important to consult with your doctor, because recognizing the difference between normal aging changes and situations requiring medical attention is crucial self-advocacy. Schedule a consultation if you experience persistent pain during or after self-care, sudden changes in sensation, including numbness or tingling that doesn't resolve, any visible changes in tissue, color, or texture, or if you have concerns about circulation or response that worry you. Many men feel hesitant discussing these topics with their physicians, but I want to give you practical language to make these conversations easier. You might say, "Doctor, I've been noticing some changes in how my body responds during private time, and I want to make sure these are normal aging changes rather than something requiring attention." Or, "I've been reading about natural approaches to support circulation, like pomegranate extract that's been studied for blood vessel health. What are your thoughts about this in my specific situation?" These conversations are completely appropriate and show you're taking active responsibility for your comprehensive health. Most physicians appreciate patients who engage thoughtfully with their wellness. Speaking of natural circulation support, the scientific interest in pomegranate's effects on aging markers continues to grow. Clinical trials are currently evaluating its impact on inflammation related to aging, cognitive function, and cardiovascular health in older adults. This demonstrates legitimate scientific attention to how nutrition can support healthy aging. The wonderful thing about the approach I've outlined is that it works with your body's wisdom rather than against it. You're not trying to recreate your 30-year-old experience, you're discovering what pleasure and satisfaction look like in your current body. What questions would you ask your doctor about incorporating gentle circulation support or stress reduction techniques into your routine? Comment below your questions. Help me create content that serves our community better. Let me share one more important perspective. Frank, age 71, came to me feeling frustrated and disconnected from his body after experiencing the exact challenges we've discussed. Frank had been married to Margaret for 45 years and felt he was letting both himself and his wife down. Working with Frank's healthcare team, we focused on the mindset shift from performance to presence. Frank learned to appreciate sensation without demanding specific outcomes. Within 2 months, he told me he felt more satisfied with intimate time than he had in years, not because his body performed like it used to, but because he'd learned to appreciate what it could do now. Frank's journey reminds me why I'm passionate about this work. Your body deserves respect and care at every age. The changes you're experiencing aren't failures, they're your body's natural evolution, and you can absolutely adapt successfully. Remember, this information complements, but never replaces professional medical guidance. Your doctor knows your unique health picture and can provide personalized recommendations that consider your specific medications, conditions, and goals. The research I've shared about pomegranate extract and breathing techniques represents promising areas of study, but individual results vary. Always discuss new approaches with your healthcare provider, especially if you take blood pressure medications, blood thinners, or have cardiovascular conditions. Most importantly, be patient with yourself during this adaptation process. Learning new approaches takes time, and your body may need several weeks to adjust to gentler techniques. This is completely normal and expected. If this evidence-based approach to adapting your intimate self-care resonates with you, please subscribe for more practical wellness education that honors your partnership with your healthcare provider. Share this with someone who values both natural wellness and medical expertise together. We can help more men navigate these changes with dignity and confidence. Your body has served you faithfully for decades. Now it's asking for updated care that matches its current needs. By making these adaptations, you're not accommodating limitations, you're demonstrating wisdom, self-respect, and commitment to your ongoing well-being. That's something to feel proud of, not ashamed of.